The kids are about to go back to school. The smells of pumpkin spice are already beginning to pop up, and cooler weather will be here before you know it. You know what that means? Virus season. Health Department officials say cases of COVID are already on the rise, and that's not all you need to protect yourself from. Good news, health experts say, for the first time, there will be 3 vaccines to protect against the biggest threats. When kids go back to class, germs usually start to spread. But this year, even as they're still swimming and playing outdoors, cases of COVID are already on the rise.
Both nationally and in Virginia, we are seeing an uptick of COVID-19 trends.
This graph shows the climbing number of people being diagnosed in emergency departments of Virginia over the last few weeks.
That gives us an early warning system, if you will, about what's happening in our communities.
Heather Harmon Sloan, lead of the Virginia Department of Health's COVID-19 unit, is keeping a close eye on the trends.
Right now, the hospital admissions we're typically seeing mostly in those ages 70 years of age and older.
Good news, she says, is there will be 3 vaccines available this fall to protect against the biggest respiratory threats: an updated COVID-19 shot, the flu shot, and 2 new vaccines against RSV, one for vulnerable infants, the other for at-risk and elderly.
We're waiting for details on both of those vaccines from the CDC and FDA.
We're waiting also to hear who the CDC advises should get the new COVID vaccine and when.
This particular one, expected in the fall of 2023, is important because it's targeting the XBB variant, which is the variant that we are seeing circulate right now, as well as the new variant that's starting to increase, which is EG.5.
Vaccines, though, are not the only tool to protect from disease. Harmon Sloan reminds it's important to stay home when you're sick. If you're exposed to COVID, consider wearing a mask for 10 days. Wash your hands frequently and cough and sneeze into the crook of your elbow to help stop the spread. Now, the new COVID vaccine is in production now. The FDA could approve it by the end of this month. Stay tuned for those details.